Hi, I'm Trevor Hall. I'm the Vice President of Safety and Risk at the Healthcare Insurance Receptacle of Canada. And
Michael Gardam, I'm an infectious disease doctor here in Toronto and Chief of Staff at Humber River Hospital.
Very excited to be here with Dr. Gardam today to really talk about the hot topic of coronavirus and have that committed conversation on what may be next. So, Dr. Gardam, SARS hit Toronto and Ontario hospitals very hard in 2003. Do you think the model in 2003 is what we might do with this virus?
You know, honestly, in 2003, we were making stuff up as we went along. You got to remember at that time, we didn't have a way for public health to notify us. We really didn't have the appropriate PPE in our hospitals. Infection control was kind of an afterthought. We didn't have a test for the virus, and it clearly got away on us. So by the time we realized that we had a problem with SARS in Toronto, we already had several generations of spread going on. So we were literally pulling out all the stops trying to get rid of it, not unlike what they're doing in Wuhan right now. We did that on a small scale. So none of this is the same as that. And so I feel a lot more comfortable now than I did back in 2003.
Yeah, that makes a lot of great sense. Do you think that the current control measures are working in countries where the virus has been imported?
Yeah, so I think so. If you look at it, it's been imported now to 18 countries. And really what we're seeing is a handful of cases in those countries, always in people who either came directly back from Wuhan or had contact with somebody back from Wuhan. What we're not seeing and what we're looking for is evidence of wider community spread. So for example, here in Canada, we've had 4 cases, but what we haven't seen are people showing up in the emergency department who had no link to those cases. Right. We're not seeing anything like that. And every day that goes by makes me feel a little bit more confident that this is not taking hold in countries where it's been imported.
If we're not able to control the virus, what practical advice or what might hospitals expect?
Yeah, well, I mean, I think that's the million-dollar question right now, right? We don't know what's going to happen in China, whether all their control measures are going to ultimately work or not. The jury's still out on that. But let's say we do start to see community spread of this. The modeling studies that have been done are suggesting that this virus is not nearly as deadly as SARS, but probably spreads easier than SARS did. And the mortality rate that's currently around 2% is probably closer to 0.2%, because you always get the tip of the iceberg in any outbreak. So if we're talking a mortality rate of about 2 people per 1,000, that's getting into the realm of seasonal flu. So if I describe this as a virus that spreads between close contact, tends to affect older individuals who have pre-existing health conditions and causes lung illness, that's basically like the flu. And so we may be seeing over the coming months something which looks like a fairly bad flu season, a bit off season, but that could be the kind of thing that we're dealing with. We're clearly not going to be dealing with something like SARS.
Right. And do you feel hospitals are adequately prepared?
We're way more prepared than we were in 2003. Right. I can say that having been there. You know, we have the supplies, we have trained our staff. We can always do a better job of training people, but we're light years ahead of where we were. We have a system where public health is able to inform us what's going on. We already have a test for the virus. We're in much better shape than we were back in 2003. So I would argue, having been in infection control for 20 years or so, we're as in good shape as any country around the world right now. And we were not that 17 years ago. So we've come a long way.
Yeah, I agree. Where do you think this is going?
You know, it's hard to know. I mean, right now we're in that weird period where it potentially could be stopped in China, or it could get away on China, and because the world is so linked, we could end up getting cases around the world, and we could have the evolution of a slow pandemic. Clearly, this is not as transmissible as flu. If it were, we'd have cases here all over the place. But we could end up having a slow pandemic, and if we do, though, the good news in all of that is most of the people who are getting this seem to be getting more cold-like symptoms than getting pneumonia and ending up in the ICU. And we see that in the patient population outside of Wuhan. It's hard to know what's going on in Wuhan because it's a bit chaos right now. But outside of that, in China and the rest of the world, The mortality rate is well less than 1%, and most people are not ending up in hospital, let alone in the ICU. So there's hope there, but we'll just have to wait and see how it unfolds.
Yeah, a very practical, calm approach. Any final practical advice for?
I think, this is going to be the kind of outbreak which is going to move slowly. It's not going to be here overnight kind of thing. The hardest thing is going to be balancing the need to be on this and paying attention to it and getting stuff ready, but at the same time, not panicking. As I'm saying in the media these days, right now, currently, this is China's problem. This is not Canada's problem. We're trying to prevent it from becoming Canada's problem. And so we need to continue doing that, but walking the fine line between being aware but not panicking.
Right. Excellent. Well, thank you.
Thanks very much.